As part of activities at the Second International Conference on Public Health in Africa (CPHIA 2022), the organizers held a media workshop for journalists covering the conference on key steps in reporting health. This is to ensure that journalists get the right information from the right sources to avoid misinformation, disinformation, and other forms of information disorder and its effect.
Fake news was such a big problem that the South African government legislated against fake news. They criminalized spreading fake news that you didn't know that was warranted, that wasn't verified. And that really speaks to the importance of overall the severity of fake news and the challenge that came with it, and how governments needed to think about how we tackle fake news and how they tackle fake news. What is the truth and how do we put the truth out there in the public domain? And this question also became harder to think about because there were so many sources of information that we had at our fingertips. So is the person that we are trying to get to do the story, to write about their research, is this the right person? Is this a person who has expertise in a specific area, in a specific field? We don't take it for granted that the person has the expertise. We ask them, we say, hi, what is your expertise? What have you researched on? Do you have any links to this research that you're talking about? Can you provide us with those links? Can we check your veracity? Are you linked to a university? They're going to think I don't know what I'm talking about. Actually, your job is not to know what you're talking about. Your job is to report. Your job is to find out what's happening. So you need to ask the questions that help you know what's happening. You need to say to the person, I'm so sorry, I don't understand what you mean by this. Can you go through this for me? Can you explain this to me? And by asking those questions and leading yourself through a series of questions, you're going to get to the truth, and that's really important.
And we observed the effect that misunderstanding or actually misinformation, disinformation played. That's when I learned that these two are different, right? I had to get closer to my colleagues and ask, what's the difference between misinformation and disinformation? We were all speaking as a community member. We're all getting these WhatsApp messages, right? You should drink this, you should do this, and it was, I think, for us a barometer of we really have a lot of work to do. So the way we had the media support us in the COVID-19 pandemic, in terms of keeping the communities informed and updated, it was a way not only of working on the prevention, which was so important. If you remember early on, what measures were important? We didn't know, for example, the transmission of COVID-19. Initially, they were saying, when I say they, it's public health experts. So I'm putting myself a little bit aside for this part, because I'm on TV somewhere saying you don't have to wear masks. Because at the time, that's the evidence.
One of the issues also discussed was how the media, academia, and researchers can work together to advance public health.
We realized that in our engagement with the media, in our engagement in sharing information about the COVID, we knew there was less access for health experts that interacted with the media. So if you put that in the context of research, there are people who are doing research all across the continent. Maybe you can agree with me that some of us in this room as journalists just got to know about Conversation Africa today. You can imagine, if this resource is available to us to help our reporting, how then we don't know about it? So that situation existed. We also knew that we also learned that using local, national, or regional institutions or resources, express institution, it actually worked for us throughout the COVID-19 pandemic. We knew that from the way we work with organizations on the continent in terms of our campaigns and whatever, and that really worked. So that brings us into relating, how do we relate to the continental media, the local media in country, if you're speaking in the context of RBC, for instance, or Ministry of Health, Rwanda, for instance. And then we learned generally that communication is evolving just as diseases evolve, and therefore people who communicate in the space of public health should be able to adapt to these different situations.
It's so important to capture how the science and our knowledge evolves. So with diseases like HIV, this happens over years. And with COVID, it was literally something new every hour. And another importance also of reflecting these changes is also about your credibility as a journalist. So just because like it was raining yesterday and today is sunny, does not mean that you were lying yesterday, right? That was the situation as it was the day before. So it shows that we are here as things are happening, because I guess that's what news is, right? We are reporting on the here and now. And it's also the first draft of history, as everyone will tell us.